In health news tonight, a unique alternative to treating alcoholism and other addictions.
Well, this is a rehab program, but it focuses on keeping addicts in their own homes. News 8's medical reporter Jocelyn Memento live tonight in the New Haven newsroom with more on this out-of-the-box concept. Jocelyn.
And most people getting treated for drug and alcohol abuse get help at an inpatient treatment facility like the well-known Betty Ford Center. But an at-home rehab approach offered here in Connecticut is helping to lower the odds of relapse, bringing hope and recovery to those who want it.
Matt Ecott started smoking marijuana at 13 years old.
Within 7 years, I had experimented with basically everything.
He was hooked on heroin at 21. Along the way, was arrested at least 7 times, checked into 15 inpatient treatment centers, then relapsed.
I would just go home and say, woe is me, and eventually go back to what I knew best.
Matt turned things around after learning about Aware Recovery Care in Madison.
What our program does is it builds the trust and the intensity in the home.
Founder Steven Randazzo has visiting recovery teams treating addicts like Matt with intense face-to-face care for a year in their own environment.
In the first phase, the client is doing a lot of trust. We're doing a lot of trust building, putting the multidisciplinary team together, working with the family.
It includes close monitoring. A GPS phone app is voluntary, but does lead to accountability.
You're testing clean, you're where you're supposed to be, you're showing up for work, you're showing up to therapy.
Dr. Ellen Edens is an assistant professor of psychiatry at Yale School of Medicine.
Of the 5 initial participants, 4 were able to maintain continuous abstinence over the course of a year.
She co-authored a feasibility study on the impact of this novel approach.
When you think about addiction as a relapsing remitting disease, to see that patients could put together up to 12 months of sobriety is really promising.
Now 33 years old, Matt works for the program that prevented him from a life of addiction.
I'm actually doing this by myself with support and help, but I'm doing this. I'm actually living my own life the way I've wanted to live it.
And he's doing very well. The one-year program cost about $38,000. Some insurance companies cover 20 to 50% of it. The cost of an inpatient treatment center for 28 days could start at $30,000. Dr. Edens is looking for funding to do a controlled study to get a clearer picture of the impact of the at-home rehab program. Darren and Ann?